now move on to Mel and Raina, who work in the home care sector, which is another part of the social care sector, which is sometimes overlooked, but incredibly important. And Paul Bristow is going to ask a few questions to Mel and Raina. So over to you, Paul.
Thank you, Chair. And before I start, can I just say to Mel and to Raina, thank you for what you've done during this, just this difficult time for our country, but thank you for what you've done before that too, and thank you for the contribution you've made to people's lives. Some of the questions I'm going to ask are going to be quite similar to Laura's, but I'll try and do a bit of a different stance on some of them. But what, maybe both of you can tell me, what first attracted you to careers in social care? Mel first, perhaps.
I was 16 when I first had my first job in a care home. I went to college and did a YTS course, and showing my age there, and I just progressed from there. I took a little break while I had my children, and then 20 years ago I started working as a domiciliary care worker, which fitted in around the family and still does fit in around the family.
Raina?
I started in care about 18, and I started working at a hospital, a joint project between hospital and council as a care worker, and then joined a local agency when I moved areas, trained as a social worker, then I was a regulator for 5 years, and then have been with Agincare 16 years. And so care is something that attracted me as wanting to make a difference. I like the policy side of it. I like the direct caregiving, wanting to make a difference. And I think because I chose something I naturally loved, it's given me a great career, and one I'm keen to support others in.
And Mel, do you feel valued for what you do?
No, I feel valued by the company that I work for. I don't feel valued by members of the public, especially since COVID. It's been tough. We, get tutted out because we're in uniform out in the street, because people telling us we shouldn't have our uniforms on, but they don't understand what a domiciliary care worker does. That we go to people's houses, we work in our uniforms, and we keep those uniforms on throughout the day in everybody's house. We can't change like you can in a home. You can get changed when you go into the home, you can get changed when you leave the home. But doing dom care, you can't do that. And it's been tough, but it's the nature of the job. I don't do it to be valued by members of the public. I do it to be valued for the people I look after.
Raina, do you think Mel's experiences are typical?
Yes, I think the same issue for us. I mean, we have care homes in our group as well. We have about 55 locations across the country, and it's a mix of services. And I think what Marlene and Sue-Ann talked about in terms of the lack of parity with NHS team members definitely came out as a lack of recognition, lack of value. But even within our own group, our home care teams and our living care teams, and even our supported living teams, felt very differently to our care home teams. And I think the focus was secondarily to care homes, and there was a better understanding of what was going on. And obviously that was in the media, and there was a more heightened public awareness of that. But in terms of home care, as Mel says, the awareness is so little that they face even less recognition, and they're actually making judgments at that next step on their own in people's homes, maybe with one other person there, but making absolutely critical decisions, risk assessment, they're negotiating, they're using communication, they're having to do increasing medical tasks, and through COVID that's been very evident. We've had GPs not visiting people in both care homes and in people's own homes, so they're having to make critical judgments about people's medical condition. They were being asked to support nursing tasks that would have previously been done by primary care, and alongside that they were then not getting recognition about what they were doing. And I think that's had an impact on morale. I think areas, there's some of the aspects of key worker recognition was great, but we had similar stories to Marlene and Sue-Ann. We had people being told they weren't important, they weren't key workers. We had a registered manager told that even if she was a registered manager and a key worker, all she did was sit in an office all day. And, you know, just a complete lack of understanding about the critical role that our frontline workforce plays every day.
Just building on that, Raina, we've heard a lot about social care being not thought of in quite the same way as the NHS. And when people talk about social care, you quite rightly said they talk about care homes. You know, when we talk about home care, do you think that there's even more of a challenge? Do you think there's that divide between what people think of social care in terms of care homes and those who provide home care?
Yeah, absolutely. I mean, I think outsourced care homes are a more mature market. I think they're one that was obviously regulated slightly earlier in a different way. Had people associate beds. They can think of a care home in their locality and what it's like to drive past it, and they maybe knew someone in it, and it's kind of bed-placed care, and they can relate to that. And I think in the last 10-15 years, when I've been working with local governments and trying to contribute to central government strategy, it's been around still a fundamental lack of understanding about what home care does. And that's not just about what people like Mel do every day, it's about the scale of that work, it's about how it's paid for, how basic pay rates are constructed on costs of wages, training, support, and that feeds the end result, because we have a lack of central government understanding about home care. We then have a lack of local government and commissioning understanding about really what home care does and the challenges in it. And then that drives behaviours and practices that lead to people like Mel feeling undervalued. When they're doing a critical role, we need more people to join, and we need to retain people in that. So absolutely, home care is way down the list. And then if you start talking to people about live-in care, which is a form of domiciliary care, people don't understand that either.
Yeah. Sure. We talked a little bit about, I mean, do you feel a lot of people would claim that domiciliary care is a low-skill job? Would you agree with that?
No, not at all. Some of the things I do, we administer controlled drugs. Now, you know, nurses do that. You know, I'm not a trained nurse, but I have training so that I can do that. And we do wound care. There's so many things that we do that nurses used to do that they've just passed it on to the carers to do, but yet we don't get recognised. And like you say, we're classed as unskilled, and we're not skilled at all.
I can see the chair's unmuted, so I think he's about to tell me to wind up. So two just very, very quick questions, if I may. I did hear anecdotally that a lot of your clients were reluctant to see domiciliary care workers during COVID because of fear of catching COVID, and then their needs were left unmet. Do you think that was typical, or that was a feature of this? And I'd just also like to just ask about your experience of testing and PPE. Do you think there was enough access to testing as in your profession, and did you have enough PPE?
Yeah, we did. We eventually got enough PPE. At the start of it all, I think, Raina, you did struggle to get it, but we were well covered with what we had out in the community. And as for testing, I've not been offered tests through the company I work for, but I have been tested myself through the King's College app that I do every day on my phone.
And did you find that experience of clients not wanting to?
No, none of our clients have stopped. No, we haven't ceased seeing anybody at all through COVID. In fact, we've probably seen them more.
Okay, and just ending on a quick positive, would you advise others to pursue a career in social care?
I would, yes, because I love doing what I do. So yes, I would.
Good, thank you.
Could I just add on PPE and testing? Sorry, that we did have a tremendous challenge getting PPE. It's cost a huge amount, and we're still sitting here not knowing whether those costs will continue to be met. The guidance was obviously coming out quite thick and fast, and so just adapting to that. And testing has been similarly difficult, easier in care homes, but only recently. And I think yeah, it's still an issue about reliability and access for all of our social care workforce when they need it.
Thank you.
Thank you very much indeed, Paul. I've got a couple of colleagues who want to ask questions, but I just wonder whether I could just follow up on your question, Paul, to Mel, when you said that you would encourage your friends to pursue a career in social care. Could you just elaborate, you know, when, as we're all hoping, the pubs open on the 4th of July, and if you were sitting with a friend, you told us a bit about the grief you get, which I think will have shocked a lot of members of the committee, certainly shocked me. But what are the kind of magical moments when you're with your clients that you really take home and treasure?
It's the way we make them feel. You know, I go to work and I have to be happy and I have to be cheery for them. I might not feel happy and cheery inside. I might have had a blazing round with my husband beforehand, but it's what I do for them. It's not what I do for the company I work for or for myself. It's seeing them, the people we look after, smile every day, or when you're leaving and they've got that little grin on their face and they say thank you. That's what I do my job for, and that's what I would say to anybody who wants to go into care, that you have to not do it for the money or for, you know, obviously the money helps because we do have bills to pay, but you've got to do it because you want to make somebody else happy and you want to make them have the best life that they possibly can.
That's a lovely answer. And we heard a bit